Have you ever wondered what actually happens during a dry needling session? Today, I'm walking you through how I use it to help my patients with shoulder or elbow pain, especially my overhead athletes. We'll break down exactly where I needle, why it works, and how it fits into a full recovery plan. So imagine that a patient comes in, they're having pain in their elbow, kind of on the front side of their forearm, and they're a little bit limited with supination, and maybe they're limited with a little bit of wrist extension. This is a very common thing that I see with a lot of the athletes that come in, especially for the baseball players and people that are lifting. So before needling, we need to start with some tissue prep. We're going to do things like some soft tissue work. We're going to do some deep tissue work. We might use some instrument assisted soft tissue, also known as scraping. We're not going to make it super purple and bruised like you see on the internet because we're really only using it to activate the tissues. And something that we might also incorporate into that is some cupping with some dynamic gliding and sliding of the cup along the arm too. So whenever we have these forearm issues, the thing that we need to target most of the time is going to be the pronator teres and the flexor mass of the forearm. Ultimately, the first thing that I got to do is I have to palpate around where I got to feel around on the muscles because I got to find those little areas of increased tension throughout the muscle. Those are called the trigger points. Whenever I'm going into the dry needling, I'm going to have the patient nice and comfortable. We're just going to put the needle in. We're going to bounce it back out. Sometimes we might hook it up to a TENS unit to try to provide a little bit more pain relief. But the biggest thing and the most important part is the actual insertion of the needle and making sure that we're hitting the muscles that we need to hit in the correct spot so that way they have that nice little either twitch response or whenever we take away the needles, they have and they can verbalize significant relief of the pain immediately. Now, for shoulder needling, most of the time I'm going to be doing it because of pain in the shoulder, but also because of range of motion limitations going into internal rotation. If that's the case, then the muscle that I'm going to be needling and focusing on is going to be the infraspinatus. And the biggest part is going to be at that muscle belly where it inserts. This is a high value spot for throwers with shoulder pain. We always clean the area and check for precautions like blood thinners and palpate for trigger points by hand first, just like I said in the first part. But we just want to make sure that whenever they are having that pain, we got to find the areas that are causing the most restriction, and we're attacking those areas at the most. The big thing is like whenever we're utilizing needling, we're using it to go after spots that we can't normally get to with our hands. Whenever we're doing the needling, anatomy knowledge is super key. When we're needling the shoulder, I'm always aware of the ribs and the lungs because those are kind of the backdrop. I'm going to use a specific angle to stay safe and target the tissue along the scapula and make sure that I'm not going too deep, that I'm going to get too close to any structures that can really cause some damage. Sometimes when we're needling, you can feel a small little dull ache or even like a twitch response. That's really your nervous system reacting, and that's actually a good sign. Those are the things that we want you to actually feel whenever we are needling. After the needling, you're not really done. That's kind of just a tool that we use to reduce the pain or improve the range of motion. Like I said, after we're done, we're going to follow that up with some type of strength and movement. We might do things like rotator cuff drills, scapular stability drills, overhead control. Then if they're a thrower or a lifter, we transition to more sport-specific programming, making sure that we're getting in some plyometrics if it's needed, if they're at that phase, the throwing program if they're at that phase. We also have to keep in mind that whenever we needle, there might be some soreness. So if they're rehabbing, we want to make sure that we're making the pain feel better, but we're not overdoing it because the needling is actually masking the pain symptoms that they're having. So all in all, dry needling, it's not a magic fix, but when we use it the right way, it can be like a game changer for most of our patients. So if you're dealing with some stubborn shoulder or elbow pain, or you want to see if this fits into your rehab, let's talk. I'm going to attach a link at the bottom for a free 15-minute consult with me. All you got to do is fill out the information. I'll get in contact with you and then we can chat about it.